It's like a ticking time bomb in your brain. That's how top stroke expert Dr. Italo Linfante describes a brain aneurysm. Take a look. I want to first talk about what the interventional neuroradiology means. Big word, a lot of people don't know what it is. So can you define it for us?
Yeah, so it's basically a new discipline in neurosurgery in which instead of opening the skull to access the brain, you access the vessels of the brain through the normal pathway. So typically we go from the femoral artery in the groin or from the radial artery at the wrist, and we thread a small catheter all the way into the brain vessels. And so we repair the arteries from the inside rather than from the outside. There's, of course, a great advantage to the patient because instead of opening the skull, which is very invasive, there's increase in morbidity. The endovascular approach has shown to be much safer. And in addition, they give us a platform to use new technology that wouldn't be available if you just use the open traditional approach.
Your specialty, no doubt, to me is amazing. I mean, there are doctors and then there are doctors, and this specialty is like you said, very difficult. It takes many years to do what you have accomplished. What got you interested in this field of medicine, if I may ask?
So that's a great question. I was, when I was in Boston, maybe like 20 years ago, I saw the first cases being done. And I was blown away, but you can treat an aneurysm from the femoral artery instead of opening the skull, and the patient was doing fantastic. So I abandoned my career that I was doing there.
And what was that career, by the way?
It was in intensive care unit, neurological intensive care unit. I was on faculty
big step.
There. Yeah, and then I basically, because you have to be a fellow again, so basically I started training again for 2 years.
Oh, geez.
And my friends would say, "You're crazy. This is not going to work. I mean, you're nuts. What are you thinking about?
Starting all over after all this time."
Yeah, fixing things from the groin. I mean, it's just insanity. And here we are 20 years later.
And we are blessed to have you. So fantastic that you made that change, and you can see you have a passion for it. All right, so we're talking about cerebral aneurysms, or brain aneurysms for that matter. Tell us, we're going to show you what it looks like in just a couple minutes, so stay tuned for that. But tell us first what that is. A lot of people will say, okay, well, it's something that happens that kind of just ruptures in my body.
Right.
But what's happening?
So a brain aneurysm is a horrible condition. It's almost a kind of a bomb inside someone's brain.
That's what I've heard, like a bomb.
Yeah, that's exactly what it is. So basically an artery is like a tubular structure. It's kind of a little tube, that carries blood. And instead of being a straight tube, at a certain point it dilates out. It's like a weak spot, and so this weak spot makes a little ball, like a bubble in a tire, so to speak.
Okay.
They can be everywhere in the body, but of course in the brain are particularly deadly because when this bubble bursts, then you have blood coming out from the artery inside the brain, and that's, of course, you can imagine
devastating.
Can be deadly, yes.
Of course. I'd like you to walk over to our 3D monitor wall, if you don't mind, Doctor. I want to show our viewers exactly what we're talking about. I have so many questions, symptoms, why these things happen, but before we do all that, tell us what we're looking at, and I believe there is an aneurysm here, so show us where it is.
So this is basically a view from the bottom part of the brain, so the brain is up, and you kind of take it and upside down, you can see from the bottom part. So the arteries come from the neck all the way into the brain. You can see all those vessels coming up. The brain is an amazing organ. It receives a huge amount of blood. Just think about it. It's 1/80th of our body weight and receives 1/5 of the cardiac output. So there's lots of vessels going through. So you can see all these vessels coming up. And at a certain point at this level, you can see in this picture, you can see instead of the arteries being straight, like in this case, makes a bubble. So this bubble shouldn't be there. The artery should be like this.
Correct.
And so it means that there's the weak spot, and kind of the blood goes inside this little pouch. And of course it's weak, so it doesn't have the same structure than the other arteries. And of course something happens, increase in blood pressure or something else. These things can burst out, and the jet of blood will go straight inside the brain.
And doctor, I noticed there's a lot of vessels there, so I have a couple questions before I bring you back. For example, since there are so many vessels there in the brain, it can happen anywhere. That's my first question. And my second question is the location. Is it more riskier in certain areas as opposed to that center point?
Yeah, these are great questions. And we know that aneurysms tend to appear in branch points. You can see here there's a branch point of two arteries, and that's where aneurysm come from. This is a typical location for aneurysms. I would say, I guess in this scheme, you probably anterior communicating artery aneurysm. So that's a common place. which is not a good place for aneurysm, obviously, but there's some areas which are really much worse, like in this area here, which is the back of the brain. It's called posterior circulation. In this area, the brainstem runs, you can see here in this scheme, this is the brainstem. So if something ruptures and pushes on the brainstem, and the brainstem controls everything, control movement, control consciousness. So when this patient, when aneurysm, let's say in this branch point, or some of these vessels here, can burst, it really causes immediately loss of consciousness. People are quadriplegic, can't move anything. It's a disaster. So this location is much worse than this location. But I mean, aneurysm is not a good thing to have anyway.
Absolutely. All right, come join me over here in the desk, and let's talk about what causes brain aneurysms. We have some risk factors that you should be aware of. Age, you know, we always seem to have age as the number one. Smoking, gender, family history, high blood pressure, binge, alcohol drinking. Are we just talking a couple of these doctor, or does it have to be all of them?
Well, all of them are very important. Age, I'm not so sure, because you can see sometimes aneurysm in younger patients too. I mean, thank God they're very rare in children, but sometimes you can see them in children as well.
So you could be born with an aneurysm, for example?
I don't know, born. I think we think they're mostly acquired during the course of the life. Maybe there's a weak spot in the artery, and as the brain vessels develop, then you can have an aneurysm. So that's one. I mean, definitely being a woman, unfortunately aneurysm is really a woman disease. Being a woman has a 2-to-1 chance of having an aneurysm compared to being a man. And then definitely alcohol and smoke. I mean, we know there's a lot of literature on this regard, and women who are drinkers and smokers not only have higher chances to have an aneurysm, but the aneurysm tend to rupture, tend to burst compared to other women that are not drinker or smoker. Family history is kind of tricky, because I think sometimes you can see this very strong family history. So, for instance, I've seen patients, all of us have seen patients which the grandfather died of a ruptured aneurysm, and then the father had an aneurysm, and then the son has an aneurysm. So it's really impressive. The classical teaching is that if you have more than one aneurysm, then it's more likely to run in your family. No, to run in your family.
Okay. No doubt this is such a serious diagnosis, but the good news here, if there is any for that matter, the doctor says because of medical advancements, survival rate has increased, and that's fantastic. By the way, you can check out his full interview on the Health Channel app. It's really a great resource for you.